My name is Dr. Lou Farah and I'm a postdoctoral research fellow at the Centre for Mental Health Research here at the ANU. Well, I think mental health problems are becoming more prominent. People are starting to pay more attention to them in the community, particularly with initiatives like Beyond Blue. I think mental health problems are coming more into the fore these days. Having said that though, it can still be very difficult for a lot of people to access help for mental health problems. People face a number of barriers to accessing psychologists. For example, these can be things like cost, geographical barriers, so people in rural and remote areas, for example, may not even have access to a psychologist. But people may also feel stigma associated with mental health problems, and that may prevent people from seeking help. So with our programs and the work that we do in e-health, we'd like to try and get help to people who may not otherwise get help. I began my time at the Centre for Mental Health Research as a research assistant, and I always wanted to train to be a clinical psychologist as well. So I completed a clinical psychology PhD, which is really great because it combines clinical training as well as research training. And really the right project just sort of fell into my lap. It was really quite lucky. I'm quite interested in Lifeline and the work that they do, so when the opportunity to collaborate with Lifeline on a PhD project came about, I jumped at the opportunity. So it was really wonderful to be able to work not only in e-health, which is something that I'm very interested in, but also to work with an organisation like Lifeline as well. Mucci MS is an online therapy program that we developed here at the centre back in the early 2000s, and it was one of the first online therapy tools to be developed actually. It's a therapy program that's based on what's called cognitive behaviour therapy, which is a talking therapy that people are likely to receive if they go to see a psychologist face to face. So what we've done is we've taken the main concepts of cognitive behaviour therapy and we've found a way to be able to deliver it online so people can access the program, and when they log in they receive information and they complete exercises, and the program can also track their symptoms too. So as they're working through the program they can see whether their use of the program is actually changing how they're feeling as they go through. Blue Pages is a psychoeducational information website that we've created here at the centre, and what we mean by psychoeducation is that it contains information about depression. So on Blue Pages you'll find information about the signs and symptoms of depression and how to recognise it, and we also have information on there about all the different types of treatments that are available for depression. We've also reviewed the evidence for these types of treatments, and so not only can people look at a description of what different types of treatments actually involve, but they can also find out about what the current evidence is for those treatments as well. We've done a number of randomised controlled trials that now have demonstrated the effectiveness of Mucci in a range of different populations. So we've examined its use in the general community and also in school settings and general practice settings, and also in the Lifeline setting as well. And all of those trials have shown positive results that Mucci can be effective in reducing symptoms of depression. A lot of the work we do here at the centre is not only in trying to sort of continually develop our programs and also evaluate them, but we do a lot of work trying to disseminate these programs as well. So we work to promote our programs with different groups in the community. So we go and do talks at schools to try and get school counsellors to use our programs and to encourage them to use them with school children. We also do work with psychologists and other healthcare professionals to encourage them to use our programs as part of their practice. But we also do a lot of work just trying to promote our programs to the general community, because they are available online. They're available 24 hours a day and they're free of charge as well. We have a lot of evidence from our research studies that they're effective not only in reducing symptoms of depression, but a range of other symptom levels as well. But we also receive a lot of feedback from people through emails and through other sorts of feedback that these programs have changed people's lives. So it's not only in our randomised controlled trials that we're finding that they work, but we're also getting a lot of feedback from people in the community and from carers and from family of people who experience mental health problems that these programs are reaching them and that they're working. While Mucci and Blue Pages were some of our first tools that we developed, we've more recently developed an online therapy tool called eCouch, and we lovingly refer to eCouch as Mucci on steroids. It's a program whereas Mucci is based just on cognitive behaviour therapy and it's designed to treat depression. eCouch has a range of different therapy tools, so we have CBT as well as interpersonal psychotherapy, and we have toolkits in there for grief and loss and bereavement. But it's also a tool, an online therapy program that can be used for anxiety disorders as well. So it's an online program that offers a little bit more than what Mucci offers. Another tool that we have developed here at the centre is an online peer-to-peer bulletin board called Blue Board, and we've recently just celebrating 5,000 registered users of this board, and this is a place that people with lived experience of depression can go to support one another. So it's a place where people post messages. It's kind of a mutual support community online for people with depression. Another website we've developed is called Beacon, and Beacon is a wonderful website because it contains information about all of the kinds of programs that are available around the world, so around Australia and the world, for mental health and other physical health problems. So all online programs that exist. We've got some descriptions of what those programs are and also what the evidence is for those programs. So it's kind of a place that people can go, if they're interested in online therapy whatsoever, they can visit Beacon and they can find out all the range of programs that are available to them and what the evidence is for them as well. As a postdoc here at the centre, I'd really love to continue my work in e-health research. I find it a really exciting field, and it's a field in which I have a lot of opportunity and scope to affect the way people receive treatment in the community. In future projects, I'm going to be working on looking at evaluating our online peer support community, and I'm also going to be involved in a very large collaborative project called the Young and Well Cooperative Research Centre, which involves a number of different youth mental health organisations and universities around Australia, and together we're going to be looking at building an online virtual space for young people to be able to access mental health help.